patients come in and they say, well, I got sciatica, or I got low back pain, or I got restless leg syndrome, I've got this, I can't, my back aches, it radiates. What I want to express to you, these are all different words for practically the same thing, if that makes any sense. When you're talking about low back pain, you're just talking about the joints in the lower back. And depending on where those joints are malfunctioning is what type of symptoms you're going to manifest. Now granted, we do have disc injuries that literally mechanically press on the nerve root, okay? But what the patients also don't understand is that we have problems that come from the joint, which we call like discogenic pain or facetogenic pain, and that can cause radiation of pain. But they all stem from the same thing. Something that is terribly wrong or malfunction in the low back, which is making it weaker and weaker and causing susceptibility to injury. So I'm going to have you stand up for a second, Jill. I'm going to just go over some techniques that we can do for the low back. But if you look at the spine, you see the sacroiliac joint, you see the facet joint, and you see the intervertebral disc, and you see the nerve root that's coming out of there, okay? There's a lot of stuff happening down here, okay? And with all my training, as we look at this, we can see, again on the spine, if something's malfunctioned, we got a short leg or anything like that, I just want to get a visualization of what we actually look at when we're looking at the lumbar spine and the nerves here. Now I'm going to go through some techniques that I use for the low back, all the way from gentle techniques to the more aggressive techniques. And they all work. They all work. And don't let any chiropractor or anybody tell me this techniques work better than this one, because they've done research on this, and they all work. It all depends on who you are and what you want to do, and what age you are and how aggressive you are. Now granted, somebody that's bigger and more muscular, has more physical job, may take a stronger technique. Okay, as I showed earlier, if you can imagine the spine laying here and in all the areas of the spine that can be we can have problems with, I'm going to just go ahead and go through some of the techniques so people can see kind of what the chiropractor is before some of the things that I do as a chiropractor before they even come in to see me. Now, the first technique I'm going to do is it's a simple distraction technique. It stimulates the joint mechanical receptors. This table was invented by a chiropractor, and I'm going to go ahead and start it out. Now, of course, if a patient is acute, we're not going to just go ahead and do this. We're going to work into this. But as you can see, that spine is being stretched and mobilized, and so it frees up my hands to just gently stretch each individual one of those segments. Now, just hang on. I'm going to show you what I'm talking about here with the spine. If you can imagine the spine being opened up on each individual segment like this. You can see that can open up the nerve roots, that can open up the discs. It kind of relieves the facet joints in here, and it starts to stimulate that joint mechanical receptors, which is established that are a lot better than pain receptors, and they will override them immediately. So this is the technique, and as you can see, this is an absolute fantastic technique for an older person. It's safe, it's gentle, I can work up the spine without worry. I have so much success with this table in treating elderly patients, I can't even describe it. But that is this is a very simple technique. It's called the Leander technique, and it's absolutely fantastic. Another light force adjusting treatment, especially if a person is real acute or in a lot of pain, or they just don't want a rough adjustment, we can use the activator. And I have taken training in activator, and this type of technique has evolved tremendously. And when you use the activator, all it is a light force, high velocity adjusting instrument. It's been used by chiropractors for well over 50 years, and it is very good for the treatment of the spine and stimulating joint mechanical receptors. And we can use the activator all the way from the feet, the knees, the hips, all the way up to the base of the skull and even the jaw. And yes, I do work on the jaw. Another technique that's a light force high velocity technique is your drop technique. And the drop technique, called Thompson drop technique, and there's a lot of variations to it, but what this does is it sets up the joints to it sets up a shear force to the patient's weight, and it just set it a little bit, and then with the table dropping, we adjust the spine. It's again a very gentle, effective technique that works for patients, okay? And last but not least is the standard chiropractic, lumbar roll technique. This is what chiropractors have been doing to help patients for 100 years. Go ahead and lay on your right side, Jill. And basically we identify the area that she has a problem with in the spine, whether it be in the lower lumbar, the SI joint, or even up in the upper thoracic. And this is the mechanical aspect of an adjustment that a chiropractor can give, without, of course, stepping on the Leander table. But yeah, and then we just adjust. It feels very good. Another thing, go ahead and lay flat on your back too. Another very good technique. Obviously, I will work on knees and ankles while I'm in this position, and I also have hip adjustments that I can do for patients. So